Welcome to today's episode of the Jason Banicki Experience podcast. Going strong with these mini daily podcasts and really enjoying the concept of being able to see something and comment on it rather quickly. As always, please subscribe, rate, and review on iTunes, Stitcher, Google Play Music, CastBox, Satchel, iHeartRadio. Share with your friends, your neighbors, coworkers, people you don't like. I don't care. Let's just make this audience larger. As always, you can add me on Snapchat, Instagram, and Twitter at JASONBANICKI. You can add the podcast on Facebook at the Jason Banicki Experience Podcast, and add us on Instagram at Jason Banicki Experience. I'm going to be trying to rush to get this one out because I'll be leaving here in about 20 minutes to go to the Hornets-Cavaliers game tonight. So, chance to see one of the three greatest NBA players is something I always want to look forward to. So don't expect this one to go 15 or 20 minutes. We'll expect probably closer to 10. Obviously, I cannot go a day without talking about the defeat of the AHCA, or as Paul Ryan likes to put it, we got close to replacing Obamacare with Trump don't care. But we just didn't have the votes today. We're going to focus on phase 2 agenda issues, and then we'll worry about healthcare later. What you're really saying is you failed, Paul Ryan. I'm going to say it for you loudly and proudly. Those of you in the Republican Party who like to complain about participation trophies and everything else need to focus on your leadership, who happens to be part of that generation that helped create the participation trophies for the millennials that you seem to despise so much, and understand that today they failed at their stated goal for the last 7 years, which was to repeal Obamacare. I'm glad it failed. I don't think we need to throw out healthcare and restart all over and write a giant tax cuts for the wealthy. That wasn't the answer. That was never the answer, and it surely shouldn't be the answer going forward now. So hopefully what this does is it makes everybody take a second, hit pause, and say, okay, there are things that both sides like about the Affordable Care Act. Everybody likes people being able to stay on their parents' health care till 26. They like the coverage for pre-existing conditions. They like the fact that, people need to have health care, so there's a mandate. They don't necessarily agree with the mechanism of how to mandate that insurance. And there are just other issues that need to be fixed. There's no doubt that, we can all agree that we need to find a way to negotiate down costs, both for doctors, hospitals, prescription drug benefits, mental health care, anything you can think of. There has to be a way to negotiate down the cost of health care. Then on top of that, we need to find a way to create some cost efficiency. The concept of selling insurance across state lines, I've said before, is just impractical. That's not going to create scales of economy that we need to bring down extra healthcare costs. Because now you have to add in all these new doctors and all these new networks that many insurance companies don't negotiate with across state lines. Like, they have their group for this state, they have groups for this state, or they just have insurance policies here and insurance policies there, and they don't work across state lines. Ultimately, what I would like to see is something similar to a single payer plus system. I don't feel like that we all need to be on a Medicaid for all plan. I feel like we need a Medicaid for all plus option. So what we basically do, and I don't have the numbers, I'm going to let somebody far smarter than I create the numbers, run the math, and figure it out. We basically create a healthcare tax in this country that every human pays on every dollar they earn, and that pays for a Medicare for all system. Those who choose to go above and beyond can then buy private market insurance while still paying that Medicaid for all tax. You don't get out of it. You don't get tax credits for anything else. You pay the Medicaid for all, and then if you decide you still want something more, you can go out and buy a private insurance policy that goes on top of that as either, as a this and policy. So we still allow a private insurance market. But anybody who believes, as the Republicans touted time and again, over and over, that the free market can fix healthcare is just wrong. They are fundamentally wrong. They are fundamentally flawed, and they need to really sit back and think about that. Healthcare is not a good to be bought and sold. We're talking about people's lives. We're talking about their health, their quality of life within that life. This is not something where a supply-demand curve can fix things, okay? You only have one life. So basically it creates an infinite demand for healthcare goods and services. There is no, well, I can live with this one blocked artery because it costs too much, so let me see if I can find a discount healthcare provider, or I'll wait to have that blocked artery cleared until I can find a discount healthcare provider, or a lower peak time where there's more supply of doctors to unblock this artery than there are people with blocked arteries. It's just not a rational model for dealing with healthcare. We cannot fix the system with free market strategies. We're not going to fix it by creating coverage across state lines. We're not going to fix healthcare by saying, well, we'll leave it up to the individual states. There are just certain things that economies of scale and economies of efficiency and economies of scope and can fix better at a national level than they can at an individual state. If you live in a state with 10 million people, you're going to have a lot less bargaining power with healthcare providers, with prescription drug providers, than you will if you have 330 million people throughout the country to say, hey, here we are. We're the only game in town. This is how we're going to do it. Part of how I think you help bring down healthcare costs as well is by switching from a pay per service model to a pay per outcome. Now, I've personally had kidney stones. It took 3 different procedures to get 1 kidney stone out. So even though the first 2 were failures, I still had to pay for procedure 1, procedure 2, and procedure 3. Now, in that way, we have kind of perversely incentivized the system to create more procedures, more tests, more. Whereas if you switch to a pay per outcome method, then it is in the best interest of the doctor, the hospital, and the patient, to get things done in the least number of procedures possible. So they wouldn't be ordering a CAT scan every time for the same thing. You know, when I had my kidney stone, I think I had 3 CAT scans and 4 x-rays to figure this thing out. Doesn't there get to be a time where you know where it's at, know what it's doing, and just let's go find it and get it out? You know, fair enough. 1 x-ray, see how huge the kidney stone is, we're done. Or in my case, when you had the CAT scan, giant kidney stone, we know we need to go in the kidney, get it out, let's get it done. Boom, done. Help instead of 3 procedures, 5 or 6 x-rays / CAT scans, CT scans, whatever you want to call them. You know, it just drove the cost up, both for my insurance provider and for myself out of my pocket. You know, took time away from the doctor where they could have been doing other things, took away hospital resources. So this is how I feel like a pay per outcome provision would allow us to move healthcare forward in a more cost-efficient manner. I think we also need to revise the medical malpractice rules. Now, you're going to hear some myths about medical malpractice, that it's out of control, that it's, driving costs up, that insurance for doctors has gotten so expensive that it makes it so hard for them to practice. By most accounts, by most rational academic studies, cost is gone down significantly for medical malpractice from the 1980s at least till now. That's the research I've seen. Going back at least 30 years, we've seen a decline in the cost of medical malpractice insurance in actual dollars, not in 2012 dollars, but in real dollars. And compare, cost of medical malpractice gone down. That doesn't mean that there's not room to improve the system. We don't need ambulance chasers chasing after our doctors. What we need, though, is a means of protection for patients who have legitimate medical issues. If a doctor screws up a surgery so bad that you have to have another surgery, or you end up with an infection that causes you a severe disability, great. If a doctor screws up a suture and you end up with a scar, you can live with that. That's not going to kill anybody, okay? Unless you're a professional model of some sort, then certain circumstances have to be taken into account. But if it doesn't really negatively impact your life, your health, or your career, you shouldn't really be able to sue. Nothing's perfect. Nobody's perfect. Everybody has a bad day. With doctors and medical malpractice, obviously this creates issues where there could be bigger problems. But I'm just saying medical malpractice is something where we have to look at. Somehow neither the ACA, Obamacare, or AHCA, Trumpcare, looked at either one of these. And I don't want to beat the point down, because like I said, I want to keep these 10 or 15 minutes. I could do hours on healthcare, and I probably will still at some point in the not too distant future do a longer episode on healthcare, just because I think it would be very entertaining, and it would allow me to air out some of my thoughts on the entire subject. But what I'm saying is, now that we've seen AHCA die / Trumpcare, it's gone. RyanCare, whatever you want to call it, boom, dead. You failed. You Republicans that spent 7 years dreaming of this day, you took your shot and you missed. Now regroup and say, how do we really fix healthcare for all Americans, not the wealthy? This needs to be the focus going forward. This needs to be our game plan. This needs to be our strategy. Now, for the Democrats who seem to be ready to celebrate as if they just won the motherfucking Super Bowl, guess what? AHCA failed. ACA will be here to stay. But tax cuts for the wealthy are the next on the agenda. And I will tell you this. As a matter of fact, no matter how they do it, tax cuts for the wealthy will pass. The Freedom Caucus will not bail out people, will not bail on tax cuts for the wealthy. That is their dream. But they've been waiting for 7 years to be able to give the upper 1% even more money. And they're going to do it, and they're going to do it with harsh cuts to key programs. So where you got to focus your attention on now is moderate Republicans who might have something to lose if they lose key crucial programs for themselves. So it's a good day for America that the AHCA failed, that Trumpcare never became law of the land. But now we need to focus on fixing the ACA / Obamacare and figure out how we can reform the tax code without giving a bunch more money to the top 1% per year than most people in the bottom 50% make in a year. Thank you for tuning in and listening to the Jason Banicki Experience. As always, please subscribe, rate, review, iTunes, Google Play Music, Stitcher, Amazon, CastBox, Satchel Podcast Player, iHeartRadio. You can listen on Twitter or the Facebook page. Share with your friends. Share with your family. Share with your neighbors. Share with your dog. I don't care who's downloading it. Let them download it. Let's grow this thing. Let's grow this bad boy. Let's keep the momentum going. Like the Facebook page, Jason Banicki Experience Podcast. Add us on Instagram, Jason Banicki Experience. I'm sure I'll be posting some pictures of LeBron James and the Cavs at the Hornets game tonight. Add me on Instagram, Snapchat, and Twitter, JASONBANICKI. Peace.